Well, dust storms can leave behind more than a mess. They can also stir up spores and tiny particles that can irritate your lungs long after the storm has passed. Dr. Frank Lavecchio from Valleywise Health is here to talk about what to watch for and how to protect yourself against valley fever. Good morning.
Good morning. Thanks for having me.
Well, we appreciate you being here. You know, this is something that so many people here in the Valley talk about, valley fever. My first question is, I just have to know, you hear during a dust storm, people can get valley fever, that they're at an elevated risk. But is that really the case?
Oh, absolutely.
Okay.
There's a couple things that happen with dust storms. One is that people most at risk get into trouble. The asthmatics, the people with lung disease, the people with heart disease, and all of those things grow exponentially for emergency medicine visits. And actually, the rates of death are higher immediately after these storms for those diseases.
So what do people need to know? I mean, what exactly is happening? How can they get these little tiny spores?
That's great. You know, the best answer would be avoid going outside. It's easy for me to say.
Yeah.
You could wear an N95 mask, the ones that we kind of hated from COVID, that were a little bit bulkier and bigger and a little bit tighter. You know, a lot of people don't want to do that either. You know, the surgical masks, they don't work as well to stop this particulate matter. But you did mention valley fever, and valley fever is a fungus, and the fungus is in our dirt. So when the dirt gets, shaken up and stirred around, when there's construction or there's a storm, okay, that stuff can go into your lungs. It turns out that most of us who live in the valley for more than a decade have had valley fever, and it could just be a minor cold. I wouldn't even know it. Think it was the flu or something like that. But it turns out that some people, a small percentage of people, becomes chronic, and some people it could actually even kill them. So it's very unfortunate. It's hard to predict who's going to get it, and what to do with them.
What are the symptoms? Like if someone is feeling under the weather, maybe after a dust storm, and when can it appear after a dust storm? How far along after the event?
Right, so there's a couple things with the dust storm. The immediate event is where you get the particulate matter, and it usually causes this upper respiratory irritation and lung irritation. So cough, bringing up phlegm, lots of times it might even have dirt in it, okay? And that's worrisome. And you should come and seek medical care if you're one of the people that are prone to having these problems. The asthmatics, the lung disease, the heart disease, the extremes of age, the very old, the very young. And those are people that could get in trouble. Unfortunately, what do we do in the hospital? We examine you, we might get x-rays, sometimes we give you antibiotics, worrying that it might become infectious. But some people, unfortunately, can cause severe lung issues, and it can cause them to stop breathing or having really, really bad difficulty breathing.
It seems like one of the difficulties with this is the symptoms, because you might just think you have a common cold or the flu, maybe,
Right.
Is that right? So, I mean, how do you differentiate with valley fever and some of these other common things and issues that we deal with?
That's the million-dollar question. And I guess I'm in my 30th year of practice, and if I had somebody with valley fever or the flu, it gets very, very difficult. The good news is that we do have tests to do for the common viruses, the common respiratory viruses. We do have blood tests we can do for valley fever. They help you a little bit, but it only says that you've been exposed. So I got to get a blood test today and then get another one like in a month and see if there's any change. And I say, oh yeah, that was probably an acute exposure, or it happened at time 0 versus something that you had all along. Very, very tough to make the diagnosis. They're making a vaccine. Hopefully that's coming out soon.
I was just going to ask you that.
Yeah, that's great. And then most people don't need treatment for valley fever. It just kind of, subsides on itself. But a small percent need antifungal, and an even smaller percent, it ends up being really damaging and causing chronic illness.
Is this something that you can build immunity from? Like if you have it once, would you get it again?
Once you get it once, you do have some immunity to it. That's the other group I forgot to mention. People who have immunodeficiency, maybe HIV or on cancer treatment or on chronic steroids, those are going to be are more likely to get sick from these things.
Perfect. Well, we appreciate you being here.
Oh, thank you.
So
I'm
much.
so proud of you. I knew you win.
Oh, we love having you here, especially talking about something that affects so many people here in Arizona.
Oh, thank you. My pleasure.
All right, we have more after the break.